Welcome to MedVentures, where extraordinary lives intersect with exceptional dedication. In today's episode, we delve into the remarkable journey of Dr. Devaprasad, a senior neurosurgeon whose passion for healing extends far beyond the operating room. Dr. Devaprasad is more than just a master of his craft. He is a testament to the power of determination and passion, with a stellar academic background and a career marked by groundbreaking surgeries. Outside the hospital walls, he is a cyclist conquering mountain trails, a marathon runner pushing the boundaries of human endurance. Above all that, it's his connection with his patients that truly defines him. His patients don't just admire him, they adore him for his compassionate care and relentless dedication to their well-being. Join us as we uncover the layers of this multifaceted individual, exploring his triumphs, his challenges, and the profound impact he has on those around him. Welcome to the world of Dr. Devaprasad, the neurosurgeon, the athlete, the beloved healer. I welcome you, sir, to our show.
Thank you very much.
Can you briefly introduce yourself on your childhood and what chose you or what made you decide to become a doctor?
I was born in Chennai, which used to be the erstwhile Madras Presidency, and now it's called Chennai.
Right.
I was born in the general hospital there to parents who were working in the central government. They were railway employees. So I come from a very humble background. They were both very honest central government employees and came from a very, very low middle class background. So honesty was their forte. And in our family, we had some very brilliant doctors. Two of them I can name, my aunt and my cousin.
Okay.
They were brilliant doctors, and that is what they were the cause, for me to choose the medical profession.
Your role models.
My role models, yeah.
Okay.
That's how I...
So once you joined medical college, there are multiple professions which you can choose. You could become a physician, you could become a pediatrician. What drove you to neurosurgery as a profession?
Okay. So basically, when you finish your MBBS, when you think about post graduation, it was always ingrained into me that I should become a surgeon. Surgeon was more macho.
Okay.
It was more macho. So surgeon is more macho, and then so I always wanted to become a surgeon.
Right.
And to be more specific, I was inclined towards oncosurgery, surgical oncology.
Right.
But during my days, there were very few. Actually, there was practically no center which was offering surgical neurology training.
Okay.
Only Tata Memorial, if I can remember, that was the only thing where you had to do general surgery initially, and then subsequently train in surgical oncology, and that's why you could become surgical oncologist. So what I did was, I initially, after my graduation, as I said, we had a very eminent psychiatrist in our family, a very internationally recognized psychiatrist in our family, and so I initially tried for surgery in Chandigarh, PGI Chandigarh, but then subsequently I was falling short, so I joined psychiatry.
Okay.
After 3 months of psychiatry, I decided that I was not tuned to be a good psychiatrist.
Right.
So I went back to my surgical training, and then the next entrance that I wrote was neurosurgery, and I became an accidental neurosurgeon, if I might say so.
Okay.
So that's how I chose neurosurgery.
Okay.
But subsequently, I have no regrets about it. Okay. And I can tell you the reason at a later, sometime during the course, I can tell you why neurosurgery is so interesting.
All right. So do you recollect any specific mentor or a colleague or a friend who really pushed you or was with you in the journey of neurosurgery?
In the field of neurosurgery, the two persons whom I really revered for their different views towards the profession, and they really were inspiring me as a student in neurosurgery, where one was Dr. Chandramouli. Okay. He was an astute clinician, very, very astute clinician, and he was a real taskmaster. He was very, very good in his commission, very, very clinically oriented neurosurgeon. So his hard work knew no limits. Right. So that is one person I really respect. And the other person who had a very balanced approach, this work-life balance and a very balanced, broad outlook towards neurosurgery was Dr. Timappa Hegde. He's a very, very well-known neurosurgeon. He's actually the director of neurosurgery at Narayana Hridayalaya now.
Okay.
He was formerly faculty at NIMHANS. These are the two persons I really like. And then when I joined neurosurgery, one who had just finished his neurosurgery is a famous neurosurgeon in South India. He's in a place called Trichy, Tiruchirappalli. He's a living god of neurosurgery in that area.
I see.
The patients really respect him so much. He's absolutely erudite. He's an encyclopedia of neurosurgery. His knowledge knows no bounds in neurosurgery. He's a very talented music composer. He's a very talented musician. Literature, any speech. He's a brilliant neurosurgeon. So he, even today, when I have problems in neurosurgery, I take it at a point. Even this morning, I had a problem which I discussed with him. So when he's 5 years my senior, even today when I have a problem, I always fall back on, his name is Dr. Ramakrishna Ishwaran.
Okay.
He's Ishwaran himself.
Okay.
So I always fall back on his advice before I make a decision. So these are the three persons I respect most. Yeah.
Now, before taking up neurosurgery, our family members or any family doctor or doctors in our family would always suggest, don't take something so risky, take something which is light. Did anyone ever stop you from taking neurosurgery?
Yeah, actually, people there are three doctors. I said one was a psychiatrist, the other was a leading physiologist, neurophysiologist,
Right.
Dr. Parvati Devi. She's also very eminent. She's no more now, but she's a very eminent neurophysiologist, and her daughter. So generally, I was told that neurosurgery is a very demanding profession with a very, very high mortality. So they were dissuading me from taking that specialty. So there I found some bottlenecks. But then I got into a premier institute. I got neurosurgery, an integrated neurosurgery at a very young age, immediate after my graduation. So
Okay.
I thought I should take this challenge, and I went ahead, and I have no regrets.
Okay. So you got into a good premier institute for neurosurgery. What was your duration of training? How much time should actually a general surgeon spend time in the field of neurosurgery to come out into the real world to practice?
Okay. So as you would know, I did my postgraduate training from NIMHANS, the National Institute of Mental Health and Neurosciences in Bangalore.
Right.
And it was an integrated course. It was 5 years of neurosurgery after my MBBS.
Okay.
And it is a very, very demanding course. And, I used to tell people, it is 36 hours a day. It's not 24 hours, it's 36 hours a day. It's full time. So it's a residency program. You reside in the hospital.
Right.
Our professor was such that he never took any attendance sheet to mark my attendance, nothing. So work needs to be completed. And as you know, in such a busy institute, work never gets over.
Right.
So you're all the time on the field. So you're a full-time resident, all the time working. So it's 36 hours non-stop of work in a day. So it's full-time work. And so you would spend a 24 hours day working throughout the night. Every day you work. And the next day morning, you present the preoperative session, you present the case, and then immediately scrub up for the operation theater.
Right.
So sometimes it happens that, when a teacher is operating, you rely on the microscope to fall asleep. It's such difficult. It's very, very difficult. You rest your eyes on the microscope and tend to sleep. It's so difficult.
Right.
The extremely demanding profession. Very, very demanding. And as you know, neurosurgery, it takes long hours of surgery.
Right.
So it becomes very, very tiring. It's very, very tiring.
So apart from your 5 years of training,
Yes.
did you work as a junior consultant under someone, or you were well equipped to face the world?
The training in neurosurgery at NIMHANS is very rigorous and arduous.
Okay.
And, you spend less time on books. It's
Okay.
mostly, it's passed on from generation to generation. The senior resident becomes your teacher.
Right.
The faculty and the senior resident put on your knowledge. So it's most of the time, and it's hardly a case missed. Over the 5-year training, you would have seen all kinds of cases at NIMHANS. The volume is so high. So you would have seen all kinds of cases at NIMHANS. So it becomes, an automatic decision making. It's very easy to take a decision, and you do learn a lot of skills. Of course, as you grow older, your skill set improves, but then you need to have a few additional training modules to hone your skills. But generally, as at the end of the 5 years, you spend a couple of more months like a senior resident in training in NIMHANS. Your training is almost complete. You can handle most of the general cases that a neurosurgeon would be able to handle. That shouldn't be a problem. So it's basically you would have covered all the aspects of neurosurgery when you graduate from
all
NIMHANS.
the basics will be
ingrained into you. Yeah, that's
right. So would you consider having a good institute or a good mentor to become a good surgeon?
Both are important because see, to build up your knowledge base, you need to have a good institute, because the protocol that the institute follows, the kind of cases they deal with, they become important. At the same time, at a very personal level, it becomes very important to have a good mentor, and if you're lucky, you can have good mentors like I had. So both are important.
With such a rigorous training in all aspects of neurosurgery, do you remember any particular case in your training career which really touched your mind or really touched you and said that neurosurgery is magical? Is there any particular memory you have during those days?
Yeah, during my student days, I had some notable cases which come to my mind. One is a patient with tuberculous disease of the spine,
I see.
who was operated, and she was doing pretty well after the surgery. But for some odd reason, maybe some intercostal vessel gave up or something like that, and then she had a torrential bleeding and she passed away. That was a very tragic moment. So that was that thing which um,
Haunts you?
which haunts me always. Very, very young lady with a very pretty smile. We lost her on the table. That was one problem. The other was a patient with a large vein of Galen malformation, a huge, difficult to treat AV malformation. When in our student days, interventional radiology was not of very high caliber. So that patient was a small child, probably around say 5 years or so, multiple sittings in hospital. They were from North Karnataka. They would come to NIMHANS every other month. They would be in hospital with some problem or the other, and we would do multiple surgical procedures on them. So it was really heart-rending to see the agony in the family. They were not from a very well-to-do family, so it was very, very heart-rending.
Okay.
So these were really very difficult choices, but then all the same, the challenge made it really honed your skills.
So did you ever feel that, I mean, neurosurgery is really taking a toll on my mental side because of seeing all these kind of really difficult cases?
Not as a student.
Not as a student.
Because I knew that I had to become something in life.
Right.
I always wanted to become a oncosurgeon, as I said earlier.
Right.
But then subsequently, when I started neurosurgery, I really enjoyed my profession.
Okay.
So there is no reason to back out from that decision.
Right.
But when I started a family and children were growing up, and I was not able to spend much time with the family, and that is when you realize that you have lost out something. As a doctor, as a neurosurgeon, you really don't see your children coming up.
Right.
You really don't have a very major role. You're full-time occupied in your profession. That's when you realize, okay, yes, there's something else to life rather than just your profession. That's sometimes you feel that, yeah.
Such a long time in the hospital for 36 hours during your PG days, does it really take a toll on your health? Do you feel, yes, it is needed to improve our skills, but have you ever felt that this is getting a bit too much?
On occasions, yes. Especially as I said earlier, when it comes to the family, you have a difficult choice to make.
Right.
You have some urgent family matter to attend to, and you don't find the time. You are always drawn towards patient care for compulsions, medical or otherwise. Then it becomes, sometimes you feel, okay, whether I made a right decision, especially when you see in the current generation, there are so many other options left for the younger generation.
Right.
You really feel whether it was really a profession worth taking. But that is, that's a less of a
Concern.
regret.
Right.
But generally speaking, I really enjoyed my profession. Even to this day, between, say, for example, choosing monetary benefits and challenging something that challenges my profession, I would always prefer a challenge to my profession and my skill rather than financial gain.
Okay, that's really inspiring to hear. So, so you finished with Bangalore. You have come down to Thrissur. You have started your individual practice. How easy or difficult was it for you to build, your name as a neurosurgeon?
Okay, so to start with, I had some roots in Kerala because my mother hails from Kerala.
Okay.
She hails from Palakkad.
Right.
And I had relatives in southern Kerala. So my uncle was in Chenganur area. So I decided to start my career in the southern part of Kerala, that is in Tiruvalla. So I was the first neurosurgeon in the private setup in central Travancore area.
Oh, I see.
That time only Kottayam Medical College had a neurosurgical facility.
Okay.
And after that it was Kottayam, Holy Cross Hospital in Kottayam.
Okay.
So the priest of Pushpagiri Hospital was very, very pleasant, really a man with far-sightedness. He was a priest. He was very, very, I still remember his name. His name was Father Alexander Payampallil.
Okay.
Very, very, very
Visionary.
Visionary, very, very big visionary.
Okay.
So he really invested in a young, he said, he is a young neurosurgeon and this is the first CT scan in central Travancore area in the private setup. Let me invest in a young neurosurgeon. So he decided to bestow faith in me.
Right.
And I think I must have lived up to his reputation. So I did a very good, I started the department there.
Okay.
We started doing high-end neurosurgery. I was also young.
Right.
I was interested in doing difficult cases.
Okay.
In fact, the first case I did out of Nimhans was in a minor OT. I did a glioblastoma in a minor OT. It was really challenging. So I, in fact, called my professor, asked him whether I can go ahead, and he said, you go ahead. And then I did the first neurosurgery in a small theater.
Can you describe to our viewers what is a glioblastoma?
Glioblastoma is a very highly bloody tumor. It's a malignant tumor of the brain, and it bleeds a lot. So you need to have all the infrastructure to be geared up for such a difficult case. But I had a good training. So I spoke to my professor and asked him whether I can go ahead with that. He said, yeah, you should start doing, go ahead with that. And then I finished it successfully.
Could you sleep the previous night of that case? Do you remember?
In my younger days, it was very difficult. So I used to read up a lot before doing an innovative case, for example. I used to read up a lot.
Okay.
And one person I really remember was a very senior. He was the first Indian-made neurosurgeon, Professor Mathai. Okay. He was the first neurosurgeon of Vellore, CMC Vellore, and he was the first Indian-made neurosurgeon. And Professor Mathai was a very, very, very meticulous surgeon. And he had retired from Vellore. He had settled down in Kolanjeri, and he was very close to Tiruvalla. So he used to, send even his family members with brain tumors. He used to send them to me. That much of confidence he reposed in me. And funnily, when I started, I was presenting one paper in a national conference, and I had exhausted my slotted time. So there was no time for question and answers. But Professor Mathai stood up and asked for a comment to be made. And because he was a very senior neurosurgeon, so the faculty allowed him to make a comment. So then he made a remark. He made a remark that when he was a student, he had a medical teacher, who was not married. And the students asked him why. So then he said, this teacher told he vowed that he will marry the day he gets a car. And the day he got his car, he was too old for the institution of marriage. So what he said was, you see, here's a neurosurgeon who is young, and I told him, with whatever available material you have, you start doing difficult cases, no problem. That is what is going to goad you into higher levels of neurosurgery. So he was a very, very encouraging mind, very encouraging source for me for a young neurosurgeon who started in a small place. I really am obliged to Professor Mathai.
So very inspiring to hear for young surgeons like us, like in a minor OT doing such a critical case where you can expect the vast complication. Anything can happen at any time, but then kudos to you, sir, for
Thank
doing
you.
such a difficult case at that time. Established your practice at the hospital. How important was to build a team, and what all comprised in your team?
Are you talking about what team I had when I started,
Yes,
or
yes, yes.
basically what happened was, in neurosurgery you need a very good intensive care,
Right,
and I had two youngsters to assist me during my neurosurgical training. They were MBBS graduates, and I also had a good ICU team, a very senior staff. She was there to assist me in my ICU,
okay.
and I had some dedicated young nurses with me to assist in my neurosurgical procedures. So that formed a team, and I also had a very good anesthesia team. So that's how I did. And father invested in a very good equipment, good microscope, good
Right.
equipment. So I was able to do fair number of cases. So team is very, very important. You have to take the team with you, especially in neurosurgery.
Right.
You do the surgery, you get off, but then if you want to bring out the best, I also am reminded of my Professor A.S. Hegde, who he was also my teacher. He was a very, very dedicated neurosurgeon. I failed to mention him earlier out of sheer oversight, but then he would bring the best out of his student by encouraging words.
Right.
And it was very, very, and not only was he a good surgeon, his post-operative care, every patient he would remember in detail, and meticulous post-operative follow-up. That is very, very important. Post-operative care is very, very important in neurosurgery.
Right.
So he would really goad his team to do good post-operative care. So that is how I also learned that, and then I kept the team going, and I have fairly good result, I should say.
Right. So, what could be your success mantras over all these years? You mentioned about post-operative care. Uh, how important is communication to the patient? What are your 1, 2, 3 mantras whenever you see a patient in the OPD?
When I see a patient in the OPD, what stands possibly as a difference between probably the upcoming neurosurgeon, I wouldn't say difference, that what I would see as a word of advice for the current neurosurgery generation would be: first is make a perfect clinical diagnosis, very, very authentic diagnosis. If you're able to make a clinical diagnosis, half your problem is solved.
Right.
You should make a very authentic clinical diagnosis. That's very, very important. And just don't rely only on investigation. You make a proper clinical diagnosis. If you have conflicts, admit the patient, and then you do a proper clinical diagnosis. Very, very important.
Right.
Then study his imaging characters very well, all his investigations very well. Don't leave any stone unturned. Every small detail. The other thing is reference slips. They may carry secret information. A general practitioner referring something like that, something will percolate into your decision making.
Right.
So that is very, very important. So you choose, every detail is important, and then investigations are important. Don't overlook these things. They will really help. And then other thing is meticulous planning.
Right.
And planning, then seeing the clinical decision making, and then communicating all these things to the patient is of paramount importance. You should communicate. You are not a class apart.
Right.
You are the reason you are there is because they are there.
Right.
You are there as a doctor only because there is a patient.
Correct.
You are nowhere without a patient. So
Right.
that's very important. They are in the scheme of things. They are there and you are there.
Right.
That's very, very important. So communication is very, very important. Half the malpractice suits that are filed are because of improper communication, not because the doctor has not done much,
Right.
but it's because it's not been communicated. What the doctor has done has not been communicated properly. So it's hardly a little effort. You just put a little extra effort, communicate it well with the patient. Half your problems are solved.
Our generation of doctors, the current generation, we always complain lack of time. So whenever I've heard about your practice, I have heard that your OP goes up to like 1 o'clock at night, 2 a.m. early morning. So whenever I ask the patients, why did he see you so late at night? They would always say that he would always spend time to explain to us and give us adequate information about the surgery. So do you feel that the younger generation lack giving time to patients?
See, I wouldn't say lack of time for the current generation, but I would just define it this way. From time immemorial, the definition of, say, bradycardia and tachycardia. uh, in common man's terms, if the heart is beating too slow, it is called bradycardia. And if the heart is beating too fast, it's called tachycardia. So bradycardia means a pulse less than 60. And tachycardia means pulse more than 60, more than 100.
Right.
So from time immemorial, when man set definitions for these variations about the heart, the boundaries remain the same. The markings remain the same, 60 and 100. So when these remain unchanged, how can body physiology change? You can never change body physiology. So you can't squeeze up too many things for the body to swallow.
Right.
So you need to set time. And see, for example, what I mean is, if you're seeing, say, 10 patients in 1 hour, if you're not able to communicate to these 10 patients in 1 hour, you see these patients in 2 hours, or you see 5 patients in 1 hour. But don't try to make a shortcut out of these. That's what I mean.
Right.
You see 5 patients in 1 hour, or you make 10 patients in 2 hours. But don't try to say 10 patients in 10 hours and make a hash out of it. No, that is not acceptable.
Right.
That is not acceptable. So you need to have a proper channel of communication. And okay, at times you are really hard pressed for time. You can always tell them in a very humble way. Your body language is very, very important. You need to communicate in a humble way that, okay, yes, I have a shortage of time. So you need to be mindful about my time. That's also important.
Right.
So you need to take. But if you approach them in a humane way, many patients will understand. It's very occasionally that very unreasonable patients or bystanders, especially the bystanders are the problems. They, unrelated bystanders come, but generally if you have a very good channel, open channel, things should be all right.
Have you ever been threatened by a bystander or relative for any complication which has ever occurred to you?
Oh yes, many times. I have had an unwarranted litigation too, which is just beyond my control for no reason of mine. I put my heart out for a young patient, and I never lost the patient. Unfortunately, neurosurgery being what it is, patient was in a morbid state before he came to me. He remained in a moribund state after the treatment was over, and unfortunately, because of the financial circumstances, I had a litigation much after the patient passed away. Of course, that didn't hold water, so there was no problem. Even other times, when the result is not up to the patient's mark, you get threatens. You get threatened sometimes. You get threats. But ultimately, if you believe there is a higher force controlling all of us, I think those things will settle down.
How do you cope with these tensions in your younger days? When such a patient came to you, they throw allegations over you, litigations over you. Does it bring down your morale, or you still stay up with your head high and say that no, I will still go ahead?
Say a couple of years ago, when I was still a young neurosurgeon or a middle-aged neurosurgeon, so to say, I would have really pricked my mind hard. I would have taken things very, very hard and harsh. But now I'm over 60. So to me, I have few more years left of good life to cherish. When the world does not have good values, things are going awry. You should be crystal clear in your mind that you need to have pleasant thoughts to control the rest of your life. So if some patient, if your mind is clear, if your intentions are not malified, then you have nothing to worry about. You stay clear in your mind. No harm done.
How important is talking complications to your patients?
It's a very tricky question. Um, it depends on many factors. One is, it depends on the seniority of the person who is in contention, who is dealing with the patient. And second thing is, it also depends on the maturity of the patient and his background.
Okay.
If it is a very well-informed patient, then talking freely about complications is okay. But if it is an ill-informed patient, then talking too much about complications may cause problems for you as well as for the patient.
Okay.
You know what I mean?
Yeah.
If you have an informed patient, you can freely talk about your complications. And you can say, you look back at my results. You have come to me probably because you must have heard good things about me.
Right.
So you come to me with this thing. My intentions are clear. I want to do you good. But there are certain complications mentioned in the textbook. These things need not happen, but they can happen. They are mentioned in textbooks, but I've probably not had these complications in the recent few cases. So probably you can trust me for this. So it will go well with the patient. Whereas if an ill-informed patient and you focus too much on complications alone without mentioning good results, then you're also in quandary.
Right. You mentioned earlier that today morning you spoke to one of your seniors taking a second opinion for a particular case. How important is taking second opinion or referring a patient to another surgeon to make sure that the treatment options you have given is right or wrong?
I think it is very important to understand that concept that taking a second opinion is not bad at all. Especially if you know that you don't know much about that particular disease or how you can handle it, may be wiser to refer it to a center which is used to dealing with such cases. Okay. Whereas that is one way of looking at it. The second way is, if you feel that the patient is too much of a doubting Thomas, he likes to take a second opinion, you feel free. You can ask him to go anywhere and take a second opinion, no problem. But I found when I have difficult cases, like I was discussing with you today, I had already planned for a particular surgery for this patient, but I would like to rethink. I saw the scans, I feel I should have a rethink. So I discussed with my senior and have his opinion,
Right.
and I will incorporate it into my practice.
One of the problems we new generation surgeons feel is that if my patient goes to a senior person, we feel insecure, we feel dejected in some way that we spend so much time, we have explained to the patient, but invariably they go to next door. What do you suggest, or what advice you have for these surgeons?
So the solution to that problem, I think, is what uh, will come out through a conversation I had with my daughter recently. My daughter is in US.
Okay.
She works in the IT field. So we were just discussing about the problems that the current generation of doctors faces. So she was telling me, I was telling them, the current generation is less motivated to do more hard work compared to what we were doing in our heydays, our halcyon days. But she was telling me, you see, what happens is, as as a senior doctor, there's a time limit for practice. So, okay, in any profession, for example, a person in the prime of his productive career, say at the age of 60, he will retire.
Right.
But here are doctors who are staying beyond their time limits. So you're plus 60, 60 going 70, 70 to 80, and you're continuing to practice. So how will the younger generation get time? That's also a serious problem.
Yeah.
But my advice is, don't get dejected. I used to have the same problems when I was practicing in a small town like Tiruvalla. Trivandrum was very close. People used to go off. I would prepare the patient, post it for surgery, next day patient vanishes. Don't get dejected. Every dog has its day. You will become senior one day, you will have your day. Bide your time. Hard work pays. And your patient will be the next publicity material for your next. And then after this, the next. There won't be any death of cases.
So I would like to share with you two incidences. Two of my patients, one was almost set for surgery, and he was supposed to get admitted on Monday, and for some reason he did not get admitted. And the next, what I heard is he is already operated by Dr. Devaprasad.
Okay. Okay.
Another lady. She's her son is an anesthetist in Dubai.
Okay.
They came to me. I spent about 45 minutes, 1 hour explaining to them. So they said, yes, doctor, we will come to you. And then next, after a week, they brought the post-op X-ray, operated by Dr. Devaprasad.
Oh, okay.
So then, as you mentioned, even I was also initially feeling inside, where am I going wrong?
Okay.
Is it something? So my unit head, Dr. Ramkumar, mentioned to me. He said, as you mentioned, there is a time for you, so you'll have to wait. As long as if you feel you have done justice and you can sleep peacefully at night, nothing more to worry. Dev Prasad is a senior surgeon. You still have your time to come.
Exactly.
So
Precisely so. Very true.
yeah. So from that day on,
Yeah.
I have decided
Yeah.
not to worry.
Yeah.
So
Absolutely.
I think it's very important for us young surgeons to really not worry too much, because we are so in that rat race because of
Yes,
peer pressure.
Yes.
How many cases you have done, whether you have a busy OPD, whether you are financially stable or not.
Yeah.
All these things are in our mind, but I think ultimately there is a graph, there is a timeline which we need to wait.
See, even this morning, I was talking to another team member of mine. He's an ENT surgeon. He's an ENT surgeon par excellence.
Okay.
He's an exceedingly good neurosurgeon, ENT surgeon, endoscopic ENT surgeon. So we were just discussing about how important it is to do quality in neurosurgery or quality surgery.
Right.
Don't look at the quantity. You do one case, but do it good. That is more important than doing eons and number of cases. That's not important.
Right.
Doing cases and building your numbers is not important. Quality is most important. Ultimately, whether you have delivered good for that patient, that is more important than just doing numbers.
Right.
Number is just statistics.
So after listening to a lot of things about neurosurgery, let's change our track. I have heard that you are a marathon runner and a fitness enthusiast. When and how did that start?
Okay, so just for information, like academics apart, I've always maintained that sports, any kind of extracurricular activity is very, very important.
Right.
For example, listening to good music, you're a music enthusiast, then outdoor activities like sporting. I've never believed in indoor sport, like indoor gym and all those things.
Right.
I always believe in outdoor sport.
Right.
So I was a very good footballer.
Okay.
In fact, I was selected for the junior national football level. But then as you start aging, I was in the university for my college, medical college, and I always dwelt in sport. But when you start becoming very busy, somehow you lose a track.
Right.
And then I started realizing I was putting on weight. My wife kept on telling me, "You're putting on weight. You need to cut down." And in the melee of practice, very busy practice, I started getting hypertension.
Okay.
So I started taking tablets. So this is not going to end anywhere. So then I decided to put a full stop, started taking fitness in all seriousness. And then slowly I started reducing my weight. And thankfully, touch wood, today I'm off drugs. I don't have any tablets.
Very good.
I'm free of all medical ailments. And I started doing outdoor cycling.
Okay.
We have a good group in Tichur, so
Right.
we have long distance cycling. I've done a very modest. I've done a 200 kilometer BRM.
Okay.
Plus, subsequently, I do weekends. We have a good group here at Tichur on a cycle, so we do cycling, long distance cyclings. I've been to Shabrimala. I've been to Vagaman. We are planning trips to long distance also. And then subsequently, one mentor like Santoshji came into our life, and then he started telling us about the good values of running.
Right.
And that's how, say, probably around 3 years ago, we started running. So initially, it was just a 5-kilometer run. I started all this because I had footballing injuries.
Okay.
I started getting muscle tears and fractures, and then I decided football is getting too much for my age. So I decided to stop football. So now I started running. Initially it was 5K, then it became 10K. Then we did a half marathon. And then I did a half ultra, UT ultra, 30 kilometers. And finally, this January, I finished my first full marathon. That was a TCS, Tata Mumbai Marathon. And lately, this October, thanks to God, I was able to finish the 42-kilometer full marathon in Kochi also, the Spice Coast Marathon.
Right.
So that's how it's going. So I wish that youngsters, when they are busy practitioners of neurosurgery, don't give way to ill health. Very, very important to have sober mind and sober health. Very, very important. And now my task to my patient is not just building, because neurosurgery is very closely allied to medical disorders like diabetes, hypertension, and it's a growing problem in the younger generation. Sedentary life.
Right.
Extremely important. I spent a whole lot of time. I'm a busy neurosurgeon. Why should I examine his blood pressure? But that is very, very important. Checking the blood pressure, I do it myself. It builds a faith in the patient.
Okay.
Second thing is you can warn him. Recently, I did a pituitary adenoma. That fellow came to me with visual loss, pituitary adenoma. So what I do, just casually just check his blood pressure, 220, 130. So then a separate chain of thoughts keeps coming to me. Whether he's got a pheochromocytoma, it has got a bearing on anesthesia.
Okay.
Whether it's a part of multiple endocrine neoplasia. So you have those things in mind. And then you bring down your BP. Suppose I had not noted this, it would have been a serious crisis. Right. And he's a little obese. So I need to explain to them. So health is very, very important. So as a neurosurgeon, you have umpteen number of cases where during operative neurosurgery, doctors have succumbed. So it's very important to make a healthy lifestyle. So I would really encourage the current generation of doctors to focus on health or their own health also, mental as well as physical health.
How would someone start if someone new wants to start something now? Do you have any suggestions on what should they start first, or is it as per their interests?
Yeah, I think it's a lot to do with their own interests. Some people, it's my personal preference that I was talking to you about.
Right.
If some people prefer outdoor or indoor activities, they do well. Ultimately, you need to stay fit all through your life. That is of paramount importance. So focus on those aspects. If you like indoor sports like going to a gym or indoor sporting activities, playing shuttle, playing tennis or swimming, fine, no problem. If you like outdoor activities like running and all those cycling and other activities, fine. It's left to you. Right. But then since you have a very large reservoir of information today, you can choose what you want. And based on your needs, based on your capabilities, you can go ahead. But then stay fit. That's my mantra.
So listening to you, sir, about, at the age of 60, doing an ultra full marathon, I mean, that's something really inspiring. Like you have covered so much. Now, this is a big fulfill moment, reaching a full marathon. Is there any fulfilling moment in your career or in your practice which you feel, yes, this is it. This is what I work for?
I can recall one particular case. As you know, neurosurgery is a specialty which involves long hours of surgery, a lot of sacrifice. As you're aging, your physique should permit doing long cases. But the longest case I probably did was a 29-hour surgery. It is a very large, bizarre arteriovenous malformation. Very, very lot of bleeding will be there, and then so it's a very large AV malformation
in the brain.
So it's a brain surgery, complicated brain surgery. So I did 24 hours, 29 hours I did. Morning 11 o'clock we started the case and finished it next day evening 4 o'clock. And it is very gratifying to see that after all this, the patient is still alive. He's working in a computer firm somewhere here, and very fulfilling. So that was a fulfilling moment in my life. 29 hours of surgery.
So what preparation you did? It's a 29-hour surgery. What was the previous night? What did you prepare yourself? How did you?
I had actually not really prepared for this long ordeal. I knew that it's a difficult arteriovenous malformation. Arterial malformations are difficult brain lesions to operate upon. I knew that it's going to be difficult. I was never geared up for such a long drawn process, but then things turned out to be so. But then thankfully to Lord Almighty, your physical health permitted you to do such surgery. And then we went on, and I had a very good assistant neurosurgeon. So, and the team was good. Anesthesia, my nursing staff, entire team was good. So, thanks to God and all the team members, I could do a good job.
Are you a very religious person?
Yes, to mention, I don't believe in religion,
Okay.
but I believe in a power above me.
Right.
I'm not. I don't believe in religion, but I believe in God.
Right.
And I can tell you from experience, every time I have a problem, when I keep pleading to our Lord Almighty, things have worked in my favor. Things have worked in the favor of my patient. So I'm an ardent believer in a force above me.
Right.
But I don't believe in religion. It compartmentalizes humanity.
Right. So we're almost coming to an end of our podcast. Few pointers for the upcoming neurosurgeons or MBBS students who want to take up neurosurgery. Your few points of advice.
Okay. Regarding a graduate trainee in medical science, first and foremost, your basic MBBS training should be good. Never neglect any aspect of medical training,
Right.
be it pathology, be it anatomy, be it physiology. Everything will stand you in good stead. Like physiology, biochemistry. Even today, if you ask me about Krebs cycle, I can remember a few steps in Krebs cycle. If you ask me about brain bridge reflex, I would be able to give you something about physiology. So it's very, very important to know every subject has its own importance. And pathology is important. Pharmacology is important, because every day you're prescribing medicines to the patient. So unless you know basic pharmacology, your decisions are going to be erroneous. So every subject is important,
Right.
be it surgery, medicine. And luckily for me, neurosurgery is a specialty which is allied to medical professions. For example, it is very interconnected to medical neurology. It's very interconnected to medicine.
Right.
Because most of the neurosurgical patients are from medical background, like
Right.
diabetes related, hypertension related, so medical illnesses. So you should have a very good training in medicine.
Right.
Only then you can become a good neurosurgeon. So that's very important. Don't neglect and spend. If you're a doctor, you're condemned to hard work, and that should be the lesson. And let us not forget William Osler. The greatest wisdom comes from William Osler, the father of modern medicine. So let us learn from William Osler. Let us not forget our basic tenets. So money will come, money will go, but then ultimately, are you departing with a satisfied mind? That is more important. So that's my advice. Don't look for short-term gains. It's a long-term investment.
Right.
Medical science is a long-term investment. Invest in good investments.
So on that note, I thank you sincerely, sir, for coming for our podcast. You have added a lot of value, added a lot talking about how much time we must spend in our career, how important health, fitness is important in a doctor's life. So thank you so much. Though we are just hospitals apart, it's an honor to talk to you, and thank you for coming.
Thank you very much, Dr. Vincent.
Yeah.
Thank you for giving me this opportunity.
Thank you.
Thank you.